Hi, this is Manuel Torres with NOLA.com, the Times-Picayune. I'm here with my colleague, Piet Lipinski. We're here to talk a little bit about what's the latest on our series with Fox 8, Cracking the Code, about unveiling the prices of healthcare in New Orleans, why they're so disparate, and what can you do about it, and how can it help you save money on your healthcare. So, Jed, welcome. Why don't we first remind our viewers about Cracking the Code, what it is and where have we been?
Sure. So Cracking the Code is our partnership with Clear Health Costs, a nonprofit journalism startup in New York, and Fox 8. And starting in April of this year, we began collecting data about prices in the New Orleans area that people pay for a variety of procedures, the most common procedures, at hospital, at local medical clinic. And we also asked healthcare providers, clinics, hospitals, if they could provide us with the cash prices for the 35 most common procedures that they do. Some hospitals and providers did provide us with that information, some did not, and we wrote stories about that. We also, in the course of our reporting in, I guess it was May and June, wrote a number of stories in which we basically profiled different individuals from the New Orleans area who've had I guess you could say negative encounters with the local healthcare system. One of those was a woman who went to Tulane for a doctor, Tulane University Medical Center, for a doctor's visit, and realized that she'd been charged 3 times as much as she had for her previous doctor's visits. And she wondered why. It took her more than a month to figure out why, and she still wound up paying 3 times the amount. We spoke to another woman who will remain anonymous, who was initially quoted at $4,000 for an MRI. It turns out if she paid cash at another facility in New Orleans, she would pay only $600. So she saved around $35,000 or $4,000.
In that example you're mentioning, that woman found that because she used the tool that we created with our partners in this series, which is the price check tool. If you go to NOLA.com or to fox8live.com, you'll find the price check tool where you can compare prices for the same procedure across numerous providers in the Metro New Orleans area. We started with about 700 prices or so. By now, we have surpassed about 3,000 prices for procedures in that, in great part thanks to your help. We want you to continue to send to us that information, your bills, what you're paying, problems you're facing, so we can continue to do that reporting. Why don't you tell us now then, what's next? We have a story coming out tonight on Fox 8 at 10, and then on NOLA.com, and what are you and Lee Zurich working on?
Yeah, so in the course of our reporting, we got a lot of feedback. We heard from a lot of people who had stories to tell. Just recently, over the last couple months, we received a spreadsheet of negotiated rates that one healthcare provider in the area, who again will remain anonymous, and a number of insurance companies, those being Blue Cross, Humana, and United Healthcare. And those negotiated rates reveal a very interesting story. We'll provide the exact figures later on in our story, but the cost difference that one person would pay with one insurance company is significantly higher than what they would pay with another insurance company. These figures are hidden from the public intentionally. Insurance companies and providers do not want the general public to know what these negotiated rates are because they are so different, and it would cause an uproar if they knew. So this is going to be a pretty exciting story appearing tonight.
All right, and that story again is going to be at 10 o'clock on Fox 8, and it's going to be on NOLA.com at the same time. We'll have more information about that. In the meantime, why don't you talk to us a little bit also about the price check tool. How can people use it? That price check tool, by the way, is at fox8live.com, and it's also at NOLA.com/cracking the code. We'll put links to it in the comments below when we are done with this video, so you guys can use it if you want to. How can they search it to? Let's say I need to have an MRI of my knee because it's been in pain. I go to see the doctor and say, you should have an MRI of this. What can I do at that time?
Yeah, we have a growing list of cash prices for a wide variety of procedures in the area. If you're looking for a price quote, or you want to get a cheaper price for the procedure that you have scheduled, you can go to our database and search that procedure, and hopefully you can find a cheaper price.
And you can search in that database by using the code for the procedure that you need to have done. If you know it, there's a 5-digit number that most medical institutions, doctors, hospitals, etc. use for specific procedures. But even if you don't know the exact code of the procedure, you can just say MRI of the knee, and then that gives you a pull-down menu where you can quickly get results. What you get at that database is the information in the 35 procedures which started. You get the information that was collected by journalists with clear health costs that survey multiple providers in our area. You also get the results of the information that you readers and others like you have provided by going to the database and using your explanation of benefits, that letter, that document that sometimes is kind of hard to understand that you get from your insurance company after you've gone to the doctor or have an operation or a procedure. You can use that to enter the data on the database and help us expand this reporting and help fellow readers, fellow viewers who are trying to save money on this type of cost. One thing to note too, Jed, before we wrap up, why is it that, I understand as a consumer of healthcare, my kids, my wife, myself, we go to the doctor, what comes out of my pocket, I get that. Why does it matter if the amount that I have to, that my insurance company negotiates with the provider is different than, say, if I have one insurance company and you have another one, why should I care if it's different?
Yeah, good question. If you haven't hit your deductible, if, for example, like me, you have a $5,000 deductible through your insurance company, if you're charged $1,000 for an identical procedure, or a procedure that would cost someone else with a different health insurance provider $500, you're going to wind up paying out of pocket $500 more for the same procedure. So that's a problem for people.
And you found examples of a $500 difference for the same procedure?
Same procedure, same technicians, same exact provider. Even more than $500 difference, and that's something that we're going to explore tonight.
So this is like if I go to the grocery store and I'm picking up, a pound of grapefruit or a pound of grapes, and they cost me $10, but they cost you $5 just because you have a different.
Exactly, deal. And a comparison that you used earlier was, say you're getting an oil change at Jiffy Lube, and depending on the car insurance company that you use and the car insurance company that the person in front of you uses, you could be charged double, or they could be charged double. So clearly this doesn't make any sense. The health insurance system needs to be dramatically improved so that it approaches something resembling a free market. And that ultimately is the intention of this series that we're doing, to bring greater transparency to the healthcare market, so that people wind up getting fair prices for the kind of procedures that they receive.
Right, because before this database was created by this project, by our efforts, there was really no way, no comprehensive way for us, for you, to search multiple providers across New Orleans and compare prices. We're talking about the exact same procedure. If you know that code, you really can drill it down to that exact same procedure. I'm talking like the MRI for the knee with contrast, without contrast, because the price can be a little different. You can get multiple quotes, actual prices of what you will pay if you went to this X-ray center as opposed to that hospital or that other clinic, right? That's what we're talking about.
Exactly.
Right. Well, thanks so much for watching again. We hope that you guys tune in tonight at 10 o'clock on Fox 8 and then on NOLA.com. And then come back tomorrow morning. We'll have more information. Jed and Lizuri continue the series, Cracking the Code. In the meantime, you can go back and look at the previous reporting they've done at NOLA.com/cracking the code and at fox8live.com, where you can also find the price check tool and help us collect more healthcare data. Thanks for stopping by, Jed.
Of course.
Thank you all.